Good evening. This live session is approved for 1 AAFP prescribed credit. The recorded session is also approved for enduring credit. Today's speakers have no relevant conflicts of interest to disclose. Here are the learning objectives for this session. To receive your CME credit, please visit the appropriate link shown here after tonight's session.
Welcome back, everyone, and thank you for attending our latest virtual COVID-19 town hall. I'm Gary Leroy, and I still have the privilege of serving as your American Academy of Family Physician president. Thank you for joining us this evening. Before we get started, I just wanted to draw your attention to a statement that the AFP issued over the weekend. As many of you are aware, on Friday, the U.S. administration eliminated protections for several vulnerable populations, including people who are transgender, those with disabilities, those seeking reproductive health care, and those with limited English proficiency. These changes are concerning from a public health standpoint, and even more in the midst of this pandemic. Our statement urges the administration to withdraw these changes. You can find this statement at our press center on AAFP.org. Now, on to the focus for tonight. Since the beginning of the COVID-19 crisis, there has been a lot of misinformation circulating, and the available information has been changing as we learn more about this virus. As family physicians, it's important that we promote evidence-based information for our patients and our communities. Our guest tonight will help us navigate the current media ocean and how we can educate our communities with factual, scientific information. So let me introduce our guest. First of all, my co-host, Dr. Julie Wood, AAFP's Senior Vice President for Health of the Public and Science. And our special guest tonight is Dr. Lindsey Leininger, who is a public health educator, researcher with expertise in data-driven health policy. Welcome, Julie and Lindsey.
Hello.
Yeah, hello. So, Julie, I'll turn it over to you.
Thanks, Gary. Before we turn things to Lindsey, I want to share a couple of clinical items with you. First is the practice reopening resources on our COVID-19 site, aafp.org/reopening. As you look to expand your practice operations, this page contains guidance and resources you may find helpful. We will continue to update these as new information and resources become available. In our reopening resources, I want to specifically highlight the need to prioritize seeing patients who need routine immunizations. With COVID-19, we know from CDC research that some people, especially children, are falling behind on their immunizations. It's important we get them back into our clinical settings and prioritize getting them immunized and back on track. Now let's move on to our guest. Dr. Lindsey Leininger is a clinical professor at the Tuck School of Business at Dartmouth College, where she teaches health analytics and public health to MBA students and healthcare executives. Prior to joining Dartmouth, she spent a decade designing and leading advanced analytics projects for Medicaid policymakers, both in academic and think tank settings, along with 9 other PhD-trained female public health scientists, the nerdy girls. She writes and edits the Dear Pandemic COVID Science Communication Platform, which I encourage you all to check out. And you can see that on Facebook at Dear Pandemic, and Instagram and Twitter. So welcome, Lindsey, and take it away.
Thank you so much, Julie, for the warm welcome and the warm introduction. It's such a privilege to be here with this wonderful group, talking a little bit about lessons learned from the front lines of a grassroots, scrappy, organic science communication campaign that I run along with 9 other really wonderful women in public health. I won't go on about my background because Julie provided such a lovely introduction, but I will add one point of context, which is I've always just had a huge heart for family physicians. So I'm really excited to be here tonight. I think among the other hats that y'all wear, you are educators and you do so much patient education around evidence, around data. And as a teacher of evidence-based medicine myself, I've just always had a lot of fondness and respect for family physicians. So as I mentioned, it's my privilege and pleasure to talk to y'all tonight about some lessons learned from running the Dear Pandemic Science Communication platform. As I mentioned, it's a scrappy, organic, homegrown effort that's grown some legs and has taken off. We are 10 PhD-trained public scientists, all of whom happen to be female. One of our first followers actually coined the term, the nerdy girls. I think he made a mention on Facebook that I'm going to stop listening to the deluge of information out there and just follow those nerdy girls. The name has stuck, and that's who we are. We're the Nerdy Girl team. I'm going to give you a touch of backstory about how I got involved in this, and it was frankly a surprise, and it was unplanned. So when things started hopping with the outbreak in Wuhan, and then when they went to Italy, and then when they came closer to home here in the United States, I found that a lot of people in my personal network were texting me, were calling me, were sending me messages, asking a lot of very specific advice around issues like, should I travel for spring break? If y'all can think back to that time, seems like a different lifetime at this point. Things like, should I pull my child out of school, right? This was prior to a lot of the lockdowns. And I was surprised because unlike the group on this call, I'm not a family physician. I am, as my children like to joke with me about, a data doctor. So it did take me a little bit by surprise, but I was happy to sort of help people sort through the evidence while also encouraging them to touch base with their physician. So what I started doing was just sort of happily ad hocing, listening to people in my personal network and trying to help them figure out what the data did and did not say. I would have happily gone on just talking about data and evidence with my personal network, as I've done since I really, frankly, got in the business of being a health data diligence expert. But I got galvanized to do something a little bit more public facing. So family physicians, y'all have long time served as our best front line for information and science. And I'm thinking about a conversation we had earlier in the green room around vaccine advocacy, for example. But we PhDs really toil more, in our proverbial ivory towers. But there have been calls for scientists to get off the bench, to get out of the ivory tower and into the fight, because there has been a lot of misinformation around COVID. And perhaps more importantly, or at least perhaps complementarily, there has just been a glut of information. It's too much for any one person to curate. And how the heck can anyone sort of thread the needle of being a concerned layperson with this flood of information, some of it which is truly toxic itself? So a professor here at Dartmouth, Brendan Nyhan, he's a political scientist, has done some really compelling empirical work around how best to communicate science out during infectious disease outbreaks. Really, his seminal work was done around Zika. And his findings and what he guides scientists and PhDs to do is just to get out there and amplify the accurate messages. So that's really the most helpful thing we can do. A lot of times we just want to get the toxic stuff out of the news cycle. So just better to amplify the good. So between reading these calls to action in scientific circles and Brendan Nyhan's work, which is a little closer to home here at Dartmouth, I decided to be a little bit braver than I normally am about posting professional sorts of things on Facebook. Typically my Facebook is my sort of sacred space for my pictures of my kids and just happy personal stuff. But I started getting a little bit more public around, hey, here's some data, here's my read of the data, and pushing it out there to people who are my friends on Facebook. And lo and behold, my friend, Allison Buttenheim, we postdoc together almost 10 years ago now. She is a public health researcher. She is on the faculty at the University of Pennsylvania School of Nursing. and her friend, Malia Jones. Dr. Jones is an epidemiologist, a scientist at University of Wisconsin-Madison. We're doing the same thing on their Facebook pages. So Allison found me and she was like, look, why don't the three of us just join up and do this together to serve our personal networks a little bit more efficiently and a little bit more generally. So Allison and Malia started this Dear Pandemic page for us to post about COVID. And again, it was really done in the organic spirit of we have a 2 to 3 to 1 month crisis on our hands, and we really want to help our personal network get through it with some good evidence. Alas, it has grown from there. And now we are a team of 10 PhDs, and we have a wonderful intern and some other wonderful, truly wonderful, nerdy volunteers who have helped us with the cause, who are all working on this together. We have a nice representation across various population health sciences disciplines, and I will note for this audience in particular, we have 3 clinicians on our team. They are all nurses. We also have epidemiologists, demographers, and I am a health policy and health services researcher by background. So our very first efforts at going live on Facebook, sort of like we are tonight, were back in April, and this was really sort of the first time we consciously started tracking followers in any meaningful way. And so you can sort of see the evolution here on this slide. So back in April, we had almost 7,000 followers when we first did a video, and the update as of yesterday, I think we are at 13,400, and I think we have actually gained a couple hundred today. So for those of you in the audience who may be among those new followers, welcome and thank you. So you can see we've been growing, which has been really, really heartening. We post on 3 different types of topics: activities of daily living, going to the grocery store, whether or not we should be wearing masks, how to stay safely in a hotel room, these types of issues, very sort of nuts and bolts activities. We also hop on current events and controversies, especially those that regard uncertainty and emerging and changing science and data. And then last but not least, I would say these probably aren't our most popular posts, but the followers who like them really like them. So we prioritize giving some space to them too, are the posts that we sort of playfully call our data nerd alert, where we talk about sort of data dorky types of things. One of the questions that I get asked the most often is, especially actually not among lay audiences, but among science and medical audiences like y'all, is, look, I am flooded. There are so many good sources out there. Can you just give me a skinny down list of information I can read and have a good sense of what's going on? So this is Lindsey's list. I've told the hosts here that I'm happy for these slides to be made publicly available, or please don't feel like you need to write these down. Y'all can have the slide deck. These are my must-have news sources. Most of these you'll be familiar with, but perhaps you're not yet familiar with Consumer Reports' tremendous reporting during COVID. They're the ones that are doing amazing reporting. They interview infectious disease physicians and other experts on things like, how do I safely have a repair person back at my house? I love their topics. I also have just really appreciated Sanjay Gupta's work on public-facing science communication. They're fun videos of him tooting through the airport and doing so safely, of him wiping down his groceries. It's very accessible, but also very science-based. If I were on a desert island and I could only pick one news source, on my data or science or tech front, it would be Stat News. Their reporting is truly a must read during this epidemic. Their COVID work is free. The rest of their reporting is behind a paywall. I do subscribe because I like to support them financially, but it's been stellar. I also consider the Osterholm Update, which is a newish podcast from Dr. Michael Osterholm, to be a can't miss. I listen to it every week. I read the show notes, and I read the stuff out of his group CDRAP at the University of Minnesota. Another one that may not be on your radar is Wired. Wired has done some tremendous reporting around technology and digital issues as they pertain to the pandemic. They do work on, for example, the pros and the cons of digital contact tracing. We are seeing tech as a public health tool like never before, I think. And so I'm paying pretty close attention to the reporting at Wired to keep a hold of how technology is influencing the pandemic. To get my data visualization sort of fix, I like the New York Times COVID exit strategy is also quite good. People have a lot of, there's a lot of great resources, but I do like, my brain seems to like the visuals at the Times the best. When people ask me for I just want the news, nothing more, no political spin, straight down the middle, I point them to the reporting at PBS NewsHour. It's terrific. And I also like the Goats and Soda series right now a lot at NPR. It's a global health series, and it has some really interesting lenses on COVID because we can learn a lot about fighting an infectious disease pandemic from international settings. So I definitely keep my eye on new reports out of Goats and Soda. It's been interesting. I mentioned several times now that we are super grassroots and we're organic. But what's really been beautiful about this is the support and the backing we have of the community. And we've grown to over 13,000 followers. And it's been quite interesting because it's led to a lot of media. It's led to policy advisory work. A trio of We Nerdy Girls did some advising early on for a Midwestern state National Guard troop as they were preparing for a safer at home order. A good deal of us, I might even say a majority of us, are currently doing ad hoc and formal advisory work for K through 12 institutions and higher ed institutions as they seek to reopen in some sort of new normal way. And I thought that y'all might appreciate this point of levity. I have spent decades doing very serious study of very serious things like data analytics and Medicaid, but I have to sort of laugh that my proverbial 5 seconds of fame will be around chips and dip, and just noting that it's not a good idea to share them in a pandemic. So things I never thought I would be talking about, much less in the New York Times as a Medicaid analytics expert, but these are not normal times. So the biggest thing I really am excited to share are emerging lessons that we've learned. You all as family physicians, I imagine this is going to land with you. It's something you probably know intuitively and have wired in your bones, but maybe haven't thought about explicitly. And I also note that I am really deeply, my pedagogical philosophy and approach is deeply steeped in the learning sciences. And I have found that probably to be the best training I've had for science communication work. I'm a big fan of the learning sciences and applying them to the teaching of public health and evidence-based healthcare. And what we learn from the learning sciences and what we're learning as a science communication platform is that stories or concrete examples are psychologically privileged. Our brains are just wired to learn best from stories as opposed to theorems, which, as a group of PhDs, we had to we had to get used to that. Also, the rule of three, there's, a lot of really good work in learning science around chunking topics. When you have a really complex topic, put it into 3 buckets, maybe add an additional consideration. You'll see as our posts have evolved and as we've gotten bigger and our product has gotten better, you will see a lot of our posts structured in this rule of 3 format. Like, here are the 3 things you need to know. We also have become pretty committed to a bluff format. This is not the normal way that PhDs write, but it is very common in business schools. So bluff is bottom line up front. So this actually, we've learned, fits well with our Q&A format where we pose a question, we put the bottom line up front and the answer, and then we provide context, typically chunked in 3s. Which provides what my communications expert colleague, Paul Argenti here at Dartmouth calls high skim value science communication. We've also learned that posts that get the most eyeballs and engagement and consideration are those with really compelling visuals, as opposed to really compelling narrative. Both together, of course, are best, but I think I have had to learn the lesson to be more intentional about the media and the visual media that we package our message with. Something that has had a little bit of staying power, for example, is an infographic that we did around staying smart. These are principles for keeping yourself safe in a pandemic. S for staying spaced, at least 6 feet apart. M for staying masked, A for air, meaning keep it outside and try to avoid poorly ventilated indoor spaces. R for restricted, so small and stable social groups, and T for time, keep it short. So we're now seeing our Facebook followers talk about the stay smart principles on their own pages, and that just makes my educator heart skip a beat. It makes me so happy. And last but not least, and y'all as physicians, again, you just know this instinctively in your bones, but we scientists sometimes, we PhDs sometimes step back with a little more reserve, and we fail to signal hope and optimism as much as we should. And this is a piece of constructive feedback I got from a personal leadership professor here at Tuck, Sid Finkelstein, who really encouraged us to stay hopeful. Don't be Pollyanna-ish, but to stay hopeful. And so we really, that advice has served us well. So my fellow nerdy girls have all adopted a particular blog post that I wrote for a physician leader group that does science-based advocacy around COVID called Impact, and I'll talk more about them in the next slide. So I wrote up a post around Lindsey's laws for smart information consumption. And specifically, they are designed to help people how to separate the solid for the sensational. So you as physicians know how to do this, but you may be seeking for an easy way to help your patients become better, Googlers, if you will, information consumers. So there's 3 laws that we write about quite frequently and take to new sort of sensational sounding stories. And the first is a quote from the late great scientist and science communicator Carl Sagan: demand extraordinary vetting for extraordinary claims. If it sounds too good to be true, it better be backed up by a boatload of evidence. Proactively seek out competing views. This comes with our training as science and medical folks, right? We know we're trying to find alternative hypotheses, triage them, and rule them out. But I don't think that's in most people's natural way of processing information. So it's important. And we talk about this as an Abraham Lincoln approach. He assembled a team of rivals to make sure that he had no blind spots in terms of what competing views were out there. And last but not least is Professor Nyhan's excellent work around amplifying good information. Cut off the oxygen to the toxic stuff, especially for lay people on social media. It's just best to get it out of the news cycle. So I wanted to share some successes and some struggles, just honestly and candidly. And again, I imagine there'll be some, this will land with y'all in a personal way. So I think the best success we've had is gaining the trust. And in fact, there's some science communication phrasing around this, being the nerd node of trust for people as they try to make their way as individuals navigating harm reduction in their own personal lives. And indeed, I think that trust is a very sacred thing, and I don't use that word lightly. And it's so special, and it's just something I'll take with me from this, just as a really important thing in my life. We have been so pleased by being part of the Women in STEM movement and being public-facing women in STEM. And last but not least, and it's especially relevant for this group, we have loved partnering with physicians. So it makes my heart happy when I see physicians' Facebook pages sharing our content, and we support and partner with this wonderful group of physician leaders in Chicago, Impact for Healthcare. I highly recommend checking them out if you haven't yet. They're doing terrific work. They're writing op-eds, they're advising policymakers. They and we work together on infographics and tools and SciComm tools that you can use yourself and that you can share with your patients. So just a huge shout out to them. The PhD and the MD combo, we're just finding to be a really nice connection as a science communication team. So our struggles, I'm hopeful for change on this front, but I have to be honest that institutions of higher learning judge scientists based on peer-reviewed publications and grant funding, and a lot of times historically science communication has not been considered real science. I do hope with COVID this is changing. I'm actually seeing glimmers of hope that science communication is going to get institutionalized as a real scientist activity. But still, we're fighting some headwinds on that space. We deal with trolls. Again, you guys are on the front lines of dealing with misinformation. And so this has long been your battle. At this point, I have a steel backbone, but I worry about the trolls in the sense that I worry about it might dissuade other more private PhDs from getting out there and also being more vocal on behalf of science. And last but not least, this was just a few of us tweeting out and Facebooking out some data and evidence. We've become an enterprise. It's a startup enterprise. So we need to organize, and we need to start thinking about seeking funding to scale. I mean, frankly, just much less to sustain. So we have to start thinking a little bit more about our own organizational structure and sustainability going forward. And with that, I'd like to kick it over to Q&A and hear your reactions and learn from people on this call. Yeah, so I think I turn it back over to you, Julie. Is that right?
That's right. Great. Thanks, Lindsey.
Yeah.
Great. Well, if you have a question, we'll open it up. And if you're viewing in a platform, you can enter from there. If you prefer to not have your name associated with the question, you can be anonymous and go to aafp.org/COVID-19 ask. You can submit your question that way. We may not get to all your questions tonight, and if we don't, you can find answers written by staff and others in the COVID communications page later in the week. So let's start looking at some questions. One was kind of a comment/question a little bit earlier from Tim Martindale on Facebook. And he says, I like stat news. The facts are great and well written, but it's hard to press on as they can't keep from politicizing some of their articles. As a physician, I try not to let the politics taint my advice to my patients. So thoughts on that, Lindsey and Gary?
Sure, Gary, if it's okay, I'm happy to chat about that. So,
You're the guest.
Oh, but you're the president.
Yes, I am.
So I am really empathetic to this comment, and just in general about media reporting and news reporting, right? So even our most trusted sources, sometimes there might be something that doesn't land with you as political or maybe political, and we try to shy away from the political on our page, but it's kind of hard to do. Just accidentally, often things become politicized that you don't know are political. So here's the general structure I keep in my mind, whether it be stat news or whether it be something else. What's powerful about you as a family physician, and I think us as a science communicator, is the power of personal connection. And in general, I find that trumps politics in terms of people being willing and open to you as a messenger. So I try to lead with personal connection first, and empathy and curiosity, and then discuss the facts as I see them. And I think that lends towards a better, more open conversation that can move past things that are political or appear political.
Do you happen to, Lindsey, notice some degree of binary thinking in our society? It's either the information is good or it's bad. It's, right, it's left. And so that's how even very credible information gets tipped politically, because they're just listening for which side are you on. It's just like the side of truth is what I'm on. I mean, how do you navigate that?
Boy, that hits. Yes, I agree with that. And I think we have a hard fight, because not only is there some dichotomous thinking, but it's not a fair fight, because even the best information is provisional, right? We're in a backdrop of uncertainty and fast changing science. So what we know today is going to be different tomorrow. Mm-hmm. Now, some stuff is just straight up wrong, always. But even the best information is only provisional and can change. And so we find ourselves advocating for science as a method, not a certain set of static facts at this point in time, which is a harder thing and a more subtle thing than this is good or bad information. Mm-hmm. So it's very much, I mean, again, this is why I'm like, Lindsey's laws, method, it's a willingness to self-correct, it's replication. I don't look for one number or one study. It's the body of studies. It's the credibility of the methods.
Yes.
It's not a sexy thing to talk about, but it's necessary.
Right. Thanks.
We had a question that came in earlier, and it was asking us to address the spin being put on data to support opening up, reopening in light of the resurgence of COVID-19 cases, particularly in rural areas, but I think that could apply to many different areas. So there's a lot of talk about reopening depending on where you live, and different communities. There could be spin on data, for example, or okay, everything's fine, this is a hoax, we can go back to work, the economy is more important. So how do you address spin being put on data, or even information being changed we hear about sometimes?
Radical transparency about what I believe to be true and why I believe it to be true. And again, if I have a personal connection, which you as family physicians, you have this beautiful sacred trust in your practice and in your community, that is an important thing. Like, you are a messenger for whom people will have their ears open. So I also lead that too, because that's part of our brand at the Nerdy Girls, right? We're your friendly nerdy girl next door. So we, the power of personal connection is big. And we just lay out the facts and why we think them, and we stay completely transparent. And that's the best we can do. That's the best we can do.
And you talk some about methods. If you have we have patients that are asking us a little bit about how do you explain more. Do you have good ideas on science communication a little bit, maybe for lay people?
Yeah.
Translation of science. Could we go into that a little bit?
Sure. In fact, this is my favorite topic. So Julie, shut me up here, because I could fill up 10 town halls with it. This is what I teach. So I'm going to give you one example, and then there are others too. But when we hear about a new study that's come out, for example, on steroids or on masks or on any new newsy item of the day, what I coach people to do is think about the 3 C's: comparison, chance, and context. Comparison. Is there a credibly comparable control group? Best is randomization. Chance. Was there a sufficiently large sample size? Has this been replicated so we don't think the vagaries of statistical noise are at play? And context. How well does the study context generalize to your setting of interest? So it's the 3 C's framework. I teach this all the time. My students who are venture capitalists and physician leaders now pull out the 3 C's framework all the time when they have to talk to their boards. So that's my favorite one to talk about studies, treatment studies. I have other sort of tips and tricks for other types of studies too. But again, this is very learning science based. 3 key bins: keep it simple, use metaphor, use alliteration, use stories.
And how about a lot of our members have started to use social media themselves. Do you have some good tips and tricks for how we might engage with our patients on social media?
Boy, that is a great question and a tough one. And I would actually look to other members of your audience for guidance on that, because I don't engage with my students on social media very much, not intentionally, just because they're young and they don't really do Facebook, they tell me. So I don't have great guidance on a personal front, but I will say that I have consumed a lot of physicians' Facebook pages, and I love them. I mean, frankly, I think that y'all are naturals at this, which is why I feel like such kindred spirits, as science communicators. So I don't have advice, just encouragement. And that what I have noticed myself among family physicians who are doing this on Facebook is that it's totally right on.
Yeah. Yeah, I'm actually curious when you say that. We teach our medical students how to read scientific literature.
Right.
And so, but I don't tend to hear anyone talking about how to read social media. And I like the 3 C's though.
Oh, thank you.
Because that's wonderful. I wrote that down.
Okay, thank you.
I did too.
Yeah, I think a lot of people out there wrote that down. So,
I appreciate that. And so what I have done, I have taught evidence-based medicine to physicians in a past life.
mm-hmm.
And what happened to me is when I came to a business school and started talking to industry folks, that language is totally foreign to them, the critical appraisal language. So I have changed it to data diligence.
I love that term.
Yeah, and I think that has worked well for business contexts and also for SciComm, because I think people in our follower base and the nerdy girls, they understand control groups and the flukes of statistical chance, and that this context is not that context. So I think there's so much good stuff in the evidence-based medicine literature, and family physicians are such amazing translators. I would love to see more of y'all get out there, and do this kind of translation on social media yourself. We'll promote it. We'll send it out. The nerdy girls will be your biggest fan.
Now that we've said this, Facebook, Galen Durose Jr. is asking us to step it up. Why does the AFP and AMA not push legislators to embrace only peer-reviewed and legitimate science, to end the cult of ignorance, as Isaac Asimov saw in the American culture? So the point is there, I think. So now we need to teach legislators how to do this too, and not to accept anything but true science. So thoughts on that? How do we get them to understand the 3 C's and how to really read and accept only science and not science?
Least qualified of the 3 of us to speak to what drives medical societies. So I might kick that one to y'all. Although I've done a lot of advisory work.
Yeah. No, in my experience with the legislators, I tend to be a teller of stories, and sharing stories, especially about people that don't have, they have a dog in the fight, but the dog is biting them. These are my patients that are suffering from the lack of opportunities or something that's troubling their life. And I'm saying that these are the people you represent. And so this is what's happening in real life. I'm not making this up. This is not going to necessarily improve my life, but it will improve all the citizens that you serve. And so telling the story is putting it into context that this is not just one story, but it's multiple stories and such. And it's not happening by chance. I'm using your 3 C's.
Thank you.
Yeah. So again,
learning, right?
I'm learning as I go here. And then drawing the contrast and the comparison that sometimes, like I just sharing a quick story, just talking to a legislative aide and talking about finances, and this person was a social worker, and learning something about the people you're talking to and why she went into social work and how she can relate to what I'm saying based on the fact that, oh, my daughter's a social worker, she's dealing with this population that's being adversely affected by this piece of legislation or the lack thereof. So making it real, making it visual for them. And that's where the stories come from. So, yeah.
Here's one for you, Lindsey, from Facebook. Amy Mullins asks, can you talk about the post-COVID nomenclature, in quotes, being used in the media? It seems like we're still in the middle. What's your forecast for the fall for a vaccine, etc.?
So we nerdy girls always joke about like how we need a crystal ball, like a nerdy girl crystal ball, but sadly we don't have it. So I'm not comfortable making forecasts for the fall, but I will speak to pieces of this. So first, I am of the Dr. Fauci camp that we're not even out of the first wave yet. So this talk of post-COVID or second wave or third wave, like I look at the data and it looks like we're still in the first wave, to me at least. I think for the fall, I am looking at schools and reopening, so I am thinking a little bit about it. But I think the fact that we all have to be adaptable and flexible, it's just going to be with us for a while because things can change so quickly. I think on the vaccine front, this is something that I am not a vaccine development expert, but boy, I've spent a lot of time studying it this past 3 months, and the voices that I trust the most on this suggest that should things go right, we're looking at an 18-month timeline. Probably the first round of vaccines will not be 100% effective. They'll get better over time. We had a virtual town hall with an infectious disease, a vaccine specialist from the University of Wisconsin last week. We have been paying very close attention to this. So I think 18 months is stunning. And then we have a lot of vaccine hesitancy even when it gets here. So I also keep a close eye on the treatment front because that's, we're going to need that too in that timeline, and the personally protective behavior front first and foremost, because I don't think anyone should be a nihilist about the fact we're still in the first wave or we're post-COVID. We have control over how this sucker spreads in a lot of ways. So I remain hopeful for the fall, and I remain activated to do the right thing and encourage other people to do the right thing.
Great. Question that came in from our webpage. How can we rebut false messaging by the current administration and others, such as the recent increase of COVID cases is solely due to increased testing, even though data disproves this?
That's a good question. And it's interesting. I will tell you my approach, and this may feel organic to you too, or this may not feel organic to you. But again, I focus on keeping the truth in the news cycle and not amplifying stuff that comes out from any given politician that I don't agree with. So again, my focus, testing's going up, but look at all these places where the positivity rate is going up, right? So bounding and benchmarking and repeating over and over and over again in all the ways you can do it, the truth that the data say, without drawing extra attention to the spin that you don't like. So when people ask me specifically, what do you think of this, for example, Wall Street Journal op-ed, I will give them my read of the data. But when I talk about bounding and benchmarking and metrics that matter, I really just don't contend with articles I don't like. I want them out. We wrote about, we've written about the video plandemic. If anyone remembers plandemic, there was a viral misinformation video. I mean, we do tackle these things, but what we do is we deal with them once and done, but we focus on the data over and over and over and over again and try to keep its half-life longer.
So you don't give energy or fuel to the misinformation.
We don't. So if somebody asks me about it, I'll give a frank assessment. But then again, what we keep in the news cycle are the data. Mm-hmm. We want to give it a longer half-life.
Yeah, good thought.
All right, question from Facebook from Brian Batchelor. What do you do when a great link that you like gets taken down suddenly as forbidden?
I scratch my head. That has actually happened to us on Facebook. We have been blocked, a couple of our posts. So frankly, I'm still learning what is forbidden and what isn't forbidden. So Brian, I am not an expert in this yet, but I'm a fellow kind of sufferer.
I wonder if there's ways that we can continue to promote information if it's not the same link, but promote the data from the link.
Absolutely.
And share the accurate information in a different way.
And this has happened. I'll give an example back to the tell a story. The original, some of y'all might remember, the original CDC guidance around reopening was pulled. Yep. The link was pulled. And I know there were a lot of frustrations around that because the document was really good. It had a lot of really good information around it. So this isn't like a theoretical question. This is something that we're all facing.
And then it found its way to the internet.
And then it found its way to the internet.
and
then it became a thing.
All right, I'm scrolling.
Okay,
Got a
while
question?
she's scrolling, I have a question just from the perspective of the nerdy girls.
Yes.
Is from a historical standpoint, do you think that with the advent of social media, that there is more misinformation floating through our society than ever before, or we just bathed in it so much 24/7 that we think that there's more out there? Because
So my personal take, and this is, I have not done any empirical work on this, so caveat all applied. But there has always been misinformation. If we look back at like past pandemics, there were misinformation campaigns for the 1918 flu. You know, misinformation has been with us a long time. It is amplified in the social media environment because the news cycle now is infinitesimally short. I mean, I wouldn't, it's always on. So science is slow. The news cycle is fast, and it's even faster with social media. So now I think our brains seek novelty. There is novelty to be had on social media, but there's not new evidence to be had. This is a problem. This is a problem for our brains, and this is a problem for us as science communicators. And this is part of the reason why people like me have to get in the game and get better at meeting the needs of novelty, but not sacrificing credibility. We have a lot to learn. We have a lot to learn. Those of us who are cautious, scientific people.
Yeah. Thinking fast and slow. And I think it's very interesting that they dubbed this the novel coronavirus, because that novel part of our
novelty, brain, right?
Yeah.
Our brains are wired just by evolution to seek and crave the novelty. And now we have it at warp speed.
Comment from Peter Leapman on YouTube. Public health strategy. I find most papers, New York Times, Washington Post articles, don't distinguish between mitigation versus suppression. So not exactly a question, but a comment I think that leads to some interesting discussion.
I think that's right. And I think just terminology in general has been sort of run roughshod a little bit. And I think each of us has sort of our particular bugbears. Mine is infectious period versus incubation period, right? Those are not the same thing. They're not interchangeable. So I think, again, there is a trade-off. I teach my students this between speed and scientific rigor. That is a trade-off we need to stare in the eyeballs because it is there. And that is true for journalism. Even the gray lady, even the best of the best have to produce things at a speed that they're not going to get every detail right 100% of the time. So we need to offer people grace because I have messed up. And when we mess up, we must be radically transparent. I mean, that's really the best I can offer. That's
a great theme for many of us, I think, for this discussion and others. That I love that radically transparent and the 3 C's.
Thank you. I mean, really, like methodological transparency is one of my most closely held professional values. So it shapes how I do my work in science communication too, and how I teach, right? I tell people this is the learning science principle from which this assignment is designed. And I think this is a really natural thing for family physicians too, because y'all are honest, right? You have to be honest with the patient that you're seeing. And transparency, it's so important.
Yeah. As a teacher, do you think that logic and STEM training should be a required course in high school so that people know how the scientific method works and how to think logically?
Oh my gosh, yes. But look, I am not an impartial observer on this, right? Look at what I do. So let's but I'm not the only one. So my mom just retired recently as a 7th grade math teacher. So she's like the original nerdy girl. So I come from a lineage of quantitative teachers. So I am horribly biased to thinking yes. But Steve Levitt, who is a public intellectual economist, wonderful public thinker, actually it is one of his missions right now to get data literacy taught in high school.
Yeah.
and to prioritize it over things that are a little bit more abstract in terms of their concepts. So he's on a mission, and boy, I am too, just in my own personal sphere. I think data literacy is literacy, and it's a requirement for responsible citizenship in this day and age.
Yeah.
You're here.
Yay!
Here's a follow-up that's a little harder though. How can we get others to listen when it seems everyone prefers to exist only in their ideological echo chambers? That comes in from our website.
That's a tough one, because we are very isolated in our echo chambers. And I think what you have to do is you have to focus on building bridges, right? So I grew up in the suburbs of North Dallas. I would say the politics and the trusted messengers of that community are different than the politics and the trusted messengers of my current college town. And so you have to get people talking to each other. You need to talk to small business people about why contact tracing is so important and so good for them. You have to involve the Chamber of Commerce in addition to the local public health department. Different messengers are going to land for different people in different echo chambers, which is why the messengers need to be working on building bridges with each other.
Great. I'm going to read a couple of comments, and then we'll be getting ready to wrap up. So Peggy Grossman says, enjoying this. Kudos to the nerdy girls.
Oh, thank you.
And there's a lot of these over here we'll have to look at afterwards. Vicki Roberts says, thank you so much for this awesome discussion. Nerdy girls are new to me, but you are a shot in the arm. Thank you, thank you, thank you.
Thank you.
Peter Leapman, we'll end with this one from YouTube again. Repetition is the key to learning. Could you repeat the 3 C's?
Yes. Thank you. Okay, so I will repeat the 3 C's, but first I'm going to do another learning science trick, and it's called retrieval practice. This is the most powerful of the learning science tips. Take a moment, everyone who's still with us, and see if you can retrieve the 3 C's from your brain. Okay, so don't worry if you've forgotten them. The act of trying to remember something you've forgotten is a powerful way to learn. That's the hopeful thing about retrieval practice. So again, it's comparison. So how controlled is the comparison that's made? And that's the biggest one among us scientists. It's chance. So are we worried about the random play of chance? So again, large sample sizes, good protections, replicated across studies, good protections. And last but not least is context. Does the study setting generalize to the context that you're interested in? So that's the generalizability concern. For those on this call who are science geeks like me, you may recognize comparison as internal validity, and you may recognize context as external validity. And you may recognize chance as p-values and confidence intervals.
Can we get buttons that have the 3 C's on them?
Yes, I would love nothing more. Nerdy girl and
little nerdy girl.
Nerdy girl buttons. Yeah.
Very good. Thank you so much, Lindsey. This has been really helpful. And I agree, it was a nice shot in the arm for all of us, and helps us energize and go back out and help our patients and ourselves filter through a lot of misinformation out there and share it correctly. Let's turn it over to you to close up a little bit and see if you have any final words, and then we'll turn it back to Gary to take us home.
Thank you, family physicians, for what you're doing. You guys are the original science communicators. So we are just happy to amplify and spread what you've been doing for a long time.
Thanks.
Thank you so much, Julie, and thank you, Lindsey. And please send our sincere thanks to the rest of the nerdy girls for everything that they're doing. And maybe we can work on a project to get those 3 C buttons out there or something.
That'd be so fun. Swag is good.
Yeah, this is such great insight about how we can make sure that we're actively encouraging the spread of factual information within our communities. For those of you out there, don't forget that the AFP keeps our COVID-19 page updated with the latest information and resources related to the pandemic. So visit the site regularly. We will be replaying this session on the communication section of the COVID-19 page tomorrow. This is the same place where we'll post the answers to your questions by the end of the week. We know that we had lots of questions that we couldn't get to, and so our staff will start working on getting those questions answered for you and posted by the end of the week. Before I close, I just want to make you aware of a very special town hall opportunity that's coming up this Monday evening, June 22nd. It's about institutional racism. It's at the forefront of many of our conversations in our country right now. While racism and health disparities have been something we've been working together to solve and address with our patients and our communities, we have an opportunity to discuss this topic in more depth at the town hall. During this town hall, we'll discuss the connection between racism and health outcomes. We'll also learn the practical skills we can apply in the clinical setting to identify as well as address racial trauma. And we'll discuss our role in advancing racial and health equity within our communities. This is a live event that will take place again on June 22nd at 7 p.m. Central Time. And I will be joined by Ms. Danielle Jones, the AFP's Director of the Center for Diversity and Health Equity, Dr. Christina Johnson, an AFP Health Equity Fellow, as well as two leaders in the Minnesota Academy of Family Physicians, President Dr. Renee Critchlow, as well as the CEO, Ms. Maria Huntley. So visit our web page or our Facebook page for more details on this very important event and make plans to join us. As we close tonight, just kind of reflecting back to what Laura was talking about with the 3 C's, let's just remember that reality and truth are the absolute zero of life. It seems impossible to achieve, but it's always worth the journey and seeking the truth in every situation of life. So again, thank you for what you are doing out there for your community and for our nation. So until we talk again, stay well, stay strong, and carry on.